When we look at hypopigmentation or loss of pigment, the common one that obviously people think about is a condition called vitiligo, in which your body's immune system attacks its own cells. That can affect any part of the body. So it may be on the face or on the backs of the hands where people can see it, but it can be anywhere over the body, including the genitals, including the armpits, and actually including the hair follicles as well. So with vitiligo, where you lose your pigment, sometimes people can have a patch of hair on their eyebrow or in their scalp where they'll just have a patch of white hair there. And that, again, it can be hugely impactful for that particular patient.
Vitiligo, for example, is that always progressive, or do people not go along because they think, well, I can deal with this one patch or this small area of skin that I've lost pigment on, but is it much more likely than not to progress and become bigger patches or more in number patches, more numerous patches?
Really, really good question. And the answer is, for any individual, we don't know. So sometimes people will have a patch of vitiligo, and it will just be one isolated patch, and it might be on a part of their body which really doesn't bother them. It might just be on their chest. They've got one small circular patch they're not bothered about. That might be all they ever get in life, and that's the end of it. And they're happy with that. But in other people, they'll get the patch on their chest, and it will slowly spread or enlarge, and very rapidly enlarge, in which case I'll probably go to a doctor sooner rather than later. Other people might get that isolated patch on their chest, nothing then happens for 5 years, then they might get another patch on the opposite side of their chest 5 years later, and it might spread at that point. So the time course is very, very variable. What I would say is that if anybody is watching or listening who has vitiligo, suspects they have vitiligo, please, please, please go and see your GP or dermatologist sooner rather than later, because there are things that can be done, particularly if you can get to vitiligo within the first 6 to 12 months. So there are things like topical steroids, topical tacrolimus cream and ointment that can be put on. There's phototherapy. As I said, there are newer biologic agents, so tablets, creams, immunosuppressive tablets that can be given, all of which can be given for vitiligo. But I think are not given because patients think, and sadly many doctors think, there are no treatments available for it. And whilst it's not life-threatening, but it's certainly life-impacting. So if you develop the beginnings of what you think might be vitiligo or patches of depigmentation on your skin, please see your doctor sooner rather than later, because there are things that can be done.
Okay, and I want to talk about treatment options now. So those treatments that you've mentioned, I don't know if you want to go into them a bit more, but what I'd want to know is, what the options are, and are there any risks of treatments, side effects, complications, that kind of thing?
Yeah. So what I would say is, for vitiligo, if it's asymptomatic, and what that means is it doesn't itch, it's not painful, which vitiligo doesn't normally itch people. It doesn't normally cause any pain. But there are treatments available. And normally, if I was seeing you as a dermatologist, I would start off with topical treatments or cream-based treatments. So one would be a topical steroid, right? So steroids work by dampening down your immune system. So what vitiligo is caused by is by your body's immune system being hyperactive, and it starts, for reasons we don't fully understand, it starts attacking your body's cells that produce melanin, the pigment-producing cells, and that's why you lose pigment there. So what we want to do is turn off that autoimmune process. So we would give a topical steroid cream, normally for a few months to begin with. Now, if you're giving steroid creams for a few months, there's not for a handful of months, I should say, in a restricted way under supervision, there aren't really any side effects to it. But if you were to use steroid creams for several months at a time without any break, without supervision, there is the risk of them thinning your skin. So it's not a long-term option for vitiligo, and that's why we sometimes use a different cream called tacrolimus or pimecrolimus, which is like a steroid cream, but not a steroid cream. So it doesn't thin your skin, but it does dampen down your immune system. But they do sting a little bit more than steroids do. They're slightly more expensive, which is probably why they're not used first line by many people. But the creams, if they're effective, they can work really well, but they tend to be more effective if the vitiligo is more confined, so on one or two discrete areas, and not rapidly spreading. I think if you're using the creams and it's rapidly spreading, then the next stage would be some form of either tablet treatment, so oral steroids can sometimes be used, but more commonly phototherapy. And what phototherapy is that you would go to a dermatology department normally, and it's like having certain wavelengths of light shone all over your body. And what that does is it reduces the immune system, in your skin at least, all over the body, which allows the pigment cells just to recover and for the pigment to appear back. And that's something that's very widely available, not just in the UK, but throughout the world. The waiting times obviously depends where in the world you are and the nature of the health system that you're in, but that is a very, very effective treatment as well. The newer agents that I mentioned, the biologic agents, so there is a cream, there are creams and there are tablets as well, but they are far more expensive. And they're newer, the side effects we don't fully understand yet, but the big barrier there is going to be the cost of them. So in some health systems, so such as the one we're in the UK, at the moment, the biologic agents aren't licensed for vitiligo. So if you were somebody that may benefit from them, you probably wouldn't be able to access it in our national health service in the UK as things stand at the moment. As time goes on, I hope and I imagine things will change, but as things stand, you can't. And then if you've gone beyond the first sort of 12 months, it is more difficult then to recover the pigment through those means, but there are surgical options as well. Again, they're more limited in the UK, but certain places in the world, so in Singapore, where I did part of my training, in Saudi Arabia, in the US, in I think Belgium, there are specialized centers where they do melanocyte grafting, where they can get pigment cells from elsewhere on your body and implant them onto areas of vitiligo and get great results with that as well. So that is an option there, but the best means of stopping the vitiligo rather than needing surgical approaches is actually to stop the vitiligo spreading to begin with, so get your treatment early. The other question I sometimes get is, are there any supplements that can help? Now, there aren't really any great evidence-based supplements for vitiligo, but there are some smaller studies suggesting a supplement called Polypodium leukotomos can be helpful for vitiligo to help repigmentation alongside other treatments. And again, some other antioxidants like ginkgo biloba are sometimes thought to be helpful as well. But these are in addition to other treatments, not instead of them. But that's vitiligo broadly in a nutshell.